November is a big cancer awareness month for lung, pancreatic, and prostate cancer awareness. One of the biggest ways to fight back against cancer is to catch it early. Here to show us how they do that is Dr. Nicholas Serrano from Overlake Medical Center. Thank you for being here.
Thank you so much for having me.
Yes, so very important conversation, so I'm glad we're talking about this. What is radiation therapy and why is it so widely used for cancer treatment?
Yeah, so obviously there's a number of different cancers that one can be diagnosed with, and radiation is a crucial part of treatment. Most people are familiar with surgery, some people are familiar with chemotherapy, but radiation is a uniquely different way of targeting and treating cancer cells and tumor cells. The way that we do this is we use high energy x-rays through very technologically advanced machines that help to target, localize the tumor, try to break up the cancer cells, damage the DNA, and make sure that this tumor shrinks, goes away, and help our patients have a long and prosperous life.
Wow, thank you for explaining that.
Yeah.
And what radiation treatments and services are offered? You kind of touched on this, and
Yeah.
how frequently would someone need the treatment?
Yeah, so there's two general categories of radiation. I would say that the majority of patients receive something called external beam radiation, but there is also an internal radiation that can also be utilized that we call brachytherapy. But for external beam radiation, it's typically a daily treatment where invisible x-rays are treating the tumor that the radiation oncologist and the team are trying to target. The treatment can be about 1 to 5 minutes a day, so it's very short, but we have to repeat it daily for somewhere between as short as 1 week, but to as long as 8 or even 9 weeks. And so we do that 5 days a week. That's what most people get a little caught off guard with, and so it is a more involved treatment where patients are actually coming to our center on a daily basis. But we're really trying to use a low dose to help damage the tumor, help kill the tumor, but kind of spare side effects and minimize side effects. So breaking it up over a longer course helps us to do that.
Wow, okay. And can you describe to your new CT SIM machine?
Yeah, so
what is this?
We're very fortunate at Overlake. We just got a brand new CT scanner, and CT scanning is incredibly crucial for planning of radiation treatment. This is our new scanner here. What this allows us to do is get the most technologically advanced images to plan one's radiation treatment. So a patient actually starts their journey with the CT simulation process. We design the treatment based off of these images. We spend less time on the table, the patient spends less time on the table because of this new technique and this new advanced equipment, which allows us as physicians to spend more time with the patients, helping to make sure that the cancer treatment is as smooth as possible.
Definitely.
Yeah.
And you touched on this with external and internal beam radiation,
Yeah.
but is there anything else you can tell us on why that would specifically be used?
So it depends on the cancer type. So there's a number of different cancers that we treat with radiation, but there are, if you go on the internet, that you're going to come across a bunch of different names, a bunch of different acronyms of different types of radiation. When it comes to external beam, I think the key ones that patients may come across are 3D conformal, which means we're trying to target a tumor with high precision. We then take that one level more advanced and use something called intensity modulated radiation therapy, which is an external beam radiation platform that really allows to concentrate the dose to the tumor, spare side effects, spare the critical organs that are around the tumor. And then we can advance that even further to something called stereotactic radiosurgery. It's not actual surgery, but it just means very precise high dose radiation where a patient can truncate basically a 4-week course of radiation into 1 or 2 sessions. And so it's very advanced, much more localized than some of these other forms of external beam treatment.
Yeah, and I know we talked about this earlier too, because I think there's some confusion on chemo, radiation, like how those both differ, if you don't mind explaining that.
Of course. The biggest thing that I always tell patients is that chemotherapy is typically given through an IV. So the medication is designed to go through the bloodstream, kind of target everywhere in the body, but the goal is to try to obviously kill off the cancer cells. Radiation is focused and localized, so we're only treating one part of the body. So if you think about it, it's more like a surgical approach, except for we're not actually using surgery. So it's a non-invasive way of doing it. But we just focus on one part of the body. We don't see some of the reactions that patients would get with chemotherapy, so it's very different in that regard.
Wow. Okay. How can people learn more about radiation oncology at Overlake?
Yeah, so the best place is to go to overlakehospital.org, /radiation oncology. We have a number of different bits of information on our website. If you're interested in getting a referral or a second opinion, the best place is always to reach out to your primary care provider or just go to the website and reach out to us directly. So.
Wow, such great information. Thank you so much
No
for
problem.
explaining all of this to me and our viewers. And to learn more about what we discussed today and to get in contact with Overlake Medical Center, just visit the website that you see there right on your screen.
This portion of New Day Northwest is sponsored by Overlake Medical Center.